A very interesting article published in the journal Pain Management in October 2023 has to do with N-acetylcysteine, or NAC as it's abbreviated, and its potential for reducing opioid intake, specifically opioid intake post-surgery in the form of prescription medication. The reason this is especially interesting is because there's a good deal of promising preclinical data and even some clinical data in humans suggesting that NAC can be effective in preventing relapse related to the intake of certain compounds, theoretically through neural mechanisms that help improve impulse control, as I'll touch on in just a little bit after going through the study. This was not a typical full-length publication. This is what's called a short communication that was published as a result of a pilot trial. I'm going to put the clinical trial registration and a link to the short communication in the description of this video so that you can go check it out for yourself. It was titled "The Impact of Post-Operative N-acetylcysteine on Opioid Consumption Following Spine Surgery, a Randomized Pilot Trial." The reason that spinal surgery patients were chosen for this study is because these patients tend to experience chronic pain, and thus they're more likely to be exposed to higher doses of opioids before, during, and after surgery. Patients in this study received a standard regimen of anesthesia in addition to a dose of NAC or a saline infusion. Information on pain and opioid consumption was then collected after the surgery. The results of the study showed that spinal surgery patients who received N-acetylcysteine in addition to the standard pain treatments reported lower pain scores and requested fewer opioids after the surgery compared to patients that only received standard pain medication and saline as a placebo. Specifically, patients given 150 milligrams of NAC per kilogram of body weight through an IV infusion while they were under general anesthesia took 19% fewer opioids 12 hours after the surgery compared to people in the placebo group. I weigh somewhere around 180 kilos, so that would be equivalent of about 12 grams of NAC for someone my size. Now, interestingly here, the effect was sustained 36 hours after surgery, with the NAC group having used 20% less opioid medication up to that point compared to the placebo group. This is really interesting because the effects of NAC seem to last longer than NAC is expected to remain in the body. Its elimination half-life is approximately 6 hours. So it looks like there isn't, or at least in this case, there wasn't a rebound effect when the NAC wore off. If there was, then you probably would have seen higher pain medication use at that 36-hour mark post-surgery. Now, is the goal or the message behind this type of research meant to stop people from taking pain medications when needed? No, not at all. It's very unlikely that opioid medication or opioid-derived medication is going to be replaced altogether anytime soon. And remember, even in this study, people were given the NAC along with standard pain medications when they were under general anesthesia. So NAC in this case was an adjunct treatment in a sense, and it may have been acting even in an adjuvant manner, meaning it may have been helping to make the primary treatment more effective. Ultimately, opioid medication will still be given to patients, but work like this might help to move in a direction where the medical community is finding ways to decrease the amount of medication that a patient needs and thus reduce the risk of negative effects of short or long-term use, which we know is common from this type of medication. Now, NAC itself is approved as a drug by the FDA for the purpose of treating acetaminophen toxicity. Acetaminophen is the active ingredient in Tylenol. It's also approved as a drug in conditions of pulmonary complications of cystic fibrosis in the form of an inhalant medication. Its use for the purpose of lowering pain scores and potentially reducing opioid usage is very interesting, and it runs in line with preclinical studies showing the promise of NAC in promoting an abstinence effect from the usage of things like alcohol, cocaine, nicotine, and cannabis. The effects of NAC on protecting against a relapse vulnerability, as it's called, it shows mixed results in clinical trials using actual people who have substance use disorders, but overall, the research is pointing in the direction that NAC in high doses, it might actually be promoting impulse control by helping to stabilize glutamate activity in the central nervous system. Glutamate is a key excitatory chemical messenger in the brain that acts like the brain's accelerator pedal, making sure that cells are communicating rapidly with one another. Now, when glutamate activity is too high, this can alter behavior in the form of increased impulsivity, which is something typically seen in people or animals going through or about to relapse. NAC seems to be able to dampen this increase in glutamate activity and stabilize activity back to levels that are seen in non-substance abuse conditions. This is at least the case in cell and some rodent models. This direct dampening of glutamate activity, along with NAC's ability to promote glutathione levels in the brain and body, have been suggested to reduce relapse-like behavior, although it doesn't seem to influence whether or not somebody's going to engage in these types of behaviors in the first place. There are other proposed mechanisms through which NAC may be acting, especially in the pain management aspect, as NAC might inhibit matrix metalloprotein enzymes that contribute to some of the inflammation associated with pain. But I think this topic requires really an entire 1 to 2, maybe 3-hour podcast dedicated to it. So if you want to see that, then please let me know in the comments. Anyways, like I said, results in human trials are mixed. So as of right now, a recommendation for NAC use for substance use disorder can't be made, as further research is required. Please remember that the contents of this video do not constitute medical advice and are not meant to substitute for standard medical practice. Please consult with your primary healthcare practitioner before beginning any nutrition or supplement-based protocols related to an actual medical condition.